experience with it?
Yeah, I've rubbed it on cervixes before. I'm not sure.
A bit maybe, but
Yeah.
taking does it too.
Yeah.
This is a friend.
Neat.
This is Molly. It's Kinja, age 2.
And she looks just like you.
No. She's so gorgeous. This is a year ago. This is our house area.
Oh, it is.
I'd like to give you a name first and spell it.
Okay. My name is Carole Hagen, C-A-R-O-L-E, Hagen, H-A-G-I-N.
All right. Let's begin with I've been a midwife, and take it wherever you want to go.
All right. Well, I've been a midwife when I began being a midwife, it was an accident. Before that, I was a labor coach or a doula person.
I want to take you right back to a date.
Okay.
No, actually I don't. I want to take you to how many years you've been a midwife.
Okay,
I've
let me
been a
quiz.
midwife for, and then you can roll your eyes and think about it. Do that.
Okay. All right.
And when you say a labor coach or a doula, just explain it. Before that, I was.
Mm-hmm.
My husband was a principal. I want you to lay the framework of your middle-class life
Okay.
in those days.
All right.
I didn't intend to be one.
No, I certainly
I know,
didn't.
you're going to say that. Okay.
Okay. You want me to say my name again?
Nope, just I've
Okay. I've been a midwife since the vicinity of 1969, when I caught my first baby accidentally and knew that it was what I wanted to be forever. I got vernix on my fingers, and that was it. Vernix is the little waxy substance that protects a baby's skin when it's in the water bag, and most babies come out with some of it on their back. It got into my skin like Pond's cold cream. I loved it. I had had 7 children of my own, and I knew I was good at birthing, and so I began teaching it way before that, I'd say 10 years before, as well as teaching breastfeeding with La Leche League. When I caught this baby, the accident was that the woman refused to go to the hospital, and the public health nurse called me and said, "Do you think you could come over here and talk this woman into going to the hospital because her husband is crippled and he can't drive?" So I got over there, and not only did I not talk her into it, but I got a toilet paper tube, and I listened to the baby's heart rate. And we used newspapers, which made print all over her bottom.
Stop a second, just in case. What do you think, Carrie? Would you like?
All that's bad.
Should we start all over?
You're right.
The name.
So
okay, we
let's
don't need the
start
name.
again.
Okay.
We'll date it with your year and with the surprise that you did not intend to become a midwife, and whether you'd ever even heard the word. Just start.
Okay.
Go for it.
I went to my first actual catch, or being a midwife type, accidentally.
I've been a midwife for.
Oh, that.
Then I went
that.
to
Okay.
my first birth.
I've been a midwife for about 27 years, since 1969. I haven't been legal that whole time. During the early years, it was a complete accident. I had no intention of being a midwife. I probably didn't even know they existed, although I had heard the word, because I had a great-grandmother who was a midwife in Nebraska. But I was teaching classes at that time after having had 7 children and doing La Leche League breastfeeding counseling. So I went ahead and started teaching classes in prepared childbirth to couples. My first birth was a complete accident when the public health nurse called me. Now, the reason she went to this woman's house was the woman called her thinking that public health nurses delivered babies. Well, they don't, and so the public health nurse knew that I was a teacher at the county hospital and called me and said, "Could you come and talk this woman into going to the hospital?" And the reason that I needed to do that was her husband couldn't talk her into it, and he couldn't drive anyway because he had muscular dystrophy and was in a wheelchair.
So let's stop here and go into the part of what was it like in 1969?
Okay.
Nobody. Go for it.
No. Well, there were a few home births happening in Berkeley and Marin in '69. I had not heard of them really, only just vaguely. And I knew there was a midwife in Berkeley named Pat. So I really had no knowledge of midwifery. However, having had all those children and coached about 300 births at the county hospital, I knew a little bit about it. So I went over there just to see this woman, see if I could drive her to the hospital. And one thing led to another, and she refused to go. So I took a toilet paper tube and listened to the heart rate. I knew what a normal heart rate was at that time from coaching births. We put newspapers under her, and the newspapers put their print on her bottom. We took a shoelace out of her shoe and boiled it up in water, and the baby came. The neat thing was that we were able to get the husband on the floor, and he put his hands out like this, and the baby slid into his hands with me sort of aiming it. And it was wonderful, and of course someone was watching over me, and she didn't have any tears. It was a lovely birth, and I had no idea about any dangers or anything like that, but I was so turned on because I got some of that vernix on my fingers and hands, and it was like it went through my bloodstream, and I knew I had to do it.
Talk about what vernix is, and don't say waxy, say creamy.
Creamy. Oh, that sounds good. Vernix is a creamy substance that's on the baby's skin in the uterus in order to protect it from the water. So that is usually present at most births, not all births, but it's a real special substance. I had heard about vernix when I went to visit Dr. Bradley back in Colorado in about 1968 with my 4-month-old baby, and he was using some of it to wax his furniture because he said it was so magical. So it definitely is magical. It went right through me. I called Pat, the Berkeley midwife, and she said, well, why don't you just do some more births and see if you really like it, and if you do, you could call me back again. And I asked her if there were any doctors that did births because I'd like to learn. I was so naive.
Stop a second, that's the car. Let's go back to, from that moment I knew I wanted to be a midwife.
Mm-hmm.
And then you could say, so I called a woman named Pat who I'd heard about.
Mm-hmm.
Okay.
Okay, so
Go for
redo
it.
those.
From that moment.
From that moment on, I knew I wanted to be a midwife.
Start that again, please. Let's wait a second.
Uh-huh.
Okay.
From that moment on, I knew I wanted to be a midwife. And I called the woman named Pat. I didn't really know her. She was in Berkeley, and asked her to help me. She said, well, why don't you do some more births? That's what I did. And once I figured it out, I could call her again. Well, that didn't make me too happy. I felt I really needed to learn. So I looked around for some doctors, and there was one over in Marin, and I called him. He was just wonderful. He invited me over. He gave me lots of instruction on birth, and he said I could come to his births in Berkeley for a while. So I did, and of course I was teaching some of his students, actually his patients that were my students at the county hospital. So it ended up that he felt I was quite capable of doing it, and he let me do the Berkeley births.
Now let's step back a bit into what was the climate in those days? Who had home births, and how many?
Hold that thought. Excuse me 1 second. I'm just going to excuse myself.
Mm-hmm.
Go ahead.
Back to Marin. But,
Thanks, David.
Oh.
Wes? And, okay.
I've been a midwife for how long? About,
I'm sorry, I'm going to ask you to start again. She hit her mic.
I hit
Oh,
the
you
mic.
hit the
Oh, I
mic.
did when I
That's
went.
okay.
See, that's
you can
typical.
have your fingers up and count
Mhm.
on them. That's
Yeah,
all right.
okay.
Do it again.
I've been a midwife for,
And keep as much eye contact with Suzanne as
Okay.
you can, too. Okay, and we're speeding, and go ahead.
I've been a midwife for about, let's see, 27 years. When I began, it was 1969, and it was not real common to have home births. I didn't really know anyone who'd ever had a home birth, although I had wished to have one with my 7th child very much, and I almost did because I barely made it to the hospital. But I didn't know anyone to help me, and I didn't understand enough about the medical end of it that I thought maybe it would be dangerous because I'm Rh negative. As it happened, in those days, there were a few people having home births in Berkeley and Marin area, but very few. It was illegal, although I did not know that. I thought it was perfectly wonderful after I did my first birth. And it seemed like it should be, completely legal. It was certainly moral, it seemed like to me, but as it ended up, it was illegal. And after I had done quite a few births, I began to be followed around by the State Board of Medical Quality Assurance. So I decided I'd better go to nursing school and become a midwife. However, there were no midwife schools then, but I was going on faith that there would be, because I had met another midwife who told me she thought that there was going to be one opening at UC. So I went back to nursing school in the mid-70s, and I still had all these children living here, which was quite interesting. Occasionally I did a birth or two during the nursing school experiences, and they all knew that I was doing them there. They were kind of disapproving, but they went along with it. My experience in the hospitals it was very interesting to be a student nurse and going to births in the hospitals, because I really felt that while I had had my 7 children in the hospital and not been happy with the way they treated me, it was still happening. In the early days, they even tied women down with handcuffs, and I had had that happen with my 3rd baby. Now, in the mid-70s, I didn't notice that, but I certainly noticed that they tied their legs up, and they did not involve them. They completely draped them. It was hard to get a husband really involved in the birth. He had to stand behind things. One hospital told us that he could only come to the birth if he was in a wheelchair and strapped in. And I thought that was amazing. More and more I realized, because my own experience with mothering was normal in spite of them, that women in the hospital working as nurses did not know what normal birth was, and doctors didn't know what normal birth was. So I was feeling really pretty excited about the fact that I was experiencing it by doing home births. During that time, I was able to teach at the county hospital to the residents that were becoming family practice doctors. They asked me to teach birth alternatives. Of course, these were kind of hippie days, and they all had long hair and things like that. They began to go out to births with me at homes. And the county decided that that would be an interesting part of their training, so they paid me per birth to go out with these doctors and deliver babies at home. They would arrive with their green outfits and their water bag breakers and their oxygen tanks, which was handy for me since it was hard for me to afford all that and difficult to get it. And we also taught the class. They did all my prenatal care for me, because at that time I didn't do prenatal care. I didn't know what was required in a prenatal visit. And
Okay, go ahead.
that was facts. So I really appreciated them doing that. I had met Tom Brewer, who was a really interesting man who was interested in nutrition for the women and had literally wiped out toxemia at the county hospital. And he did a lot of births with me. He was just wonderful. So during those years, I really had a good time. My kids came to births with me. We filmed them. We recorded them. I learned a whole lot of different things because I'm kind of a suburban housewife. I mean, I was used to my little area with my blue jeans. It ended up going to births where people didn't wear their clothes, where people all were dressed in colors and, you know, just really fun things. They had a lot of rituals around the birth, like burning sage and things like that. I also was very fortunate that I always had doctors to back me up at the county hospital, and also Alta Bates. There was a couple of doctors there that were very interested in what I was doing and came out to some of the births with me and would accept my patients if I had to transfer them, as well as my old faithful doctor from Point Reyes, who was just grand about seeing things.
Now, he is in the film. So
Whit
could
or
give me
Whitty?
his name? Whitty.
Oh,
Was
no,
it
it was
Whitty?
Dr. Whit.
Oh, it was Whit. Okay.
And
All right.
later I'll mention him
All
then.
right. So what if you could talk about now that some of these doctors you did births for, and give me a sense of how many births you've done for obstetricians, wives, family physicians, pediatricians. I want to lay the credibility.
Okay.
Let's hold that thought for a second.
Okay.
Please.
Well, we have an
The
airplane.
propeller plane.
Of course, I know.
He knows
You
all
guys get
these.
to experience it all, right?
Yeah.
You name it, it's here. Yeah, so let's talk about doctors doing
Yeah,
having home
okay.
births with you, and how recent. When was your first one, and how recent? And just a little
Gosh,
bit
I
about what
have
kind
a
of
clue
doctors
when my
and
first
how
one
many.
was.
Or doctors' wives. Okay.
Okay.
They take a while, these propeller planes to go away. They fly low.
They do.
They go slow.
Yeah, we have an airport about 5 miles away.
Just give them a couple seconds.
Have a glass of cup of water if you want to.
You want some?
I'm okay.
Okay.
I don't remember where I put it.
Hmm.
Where did I put mine? Oh yeah, mine's over there.
I had,
Or start it any way you want.
Okay.
During the years that I was doing births in the 70s and 80s, I did a lot of the doctors that were working with me at home. And that seemed to be kind of an odd thing, because most of the time they're working with other people that don't approve of home births, and they're working in hospitals where it looks like birth is really kind of a pathological event. So I was pretty excited when some of the family practice doctors asked me to do their births, and I'm not sure when the first one was. It was probably in the 70s. And one of the doctors who had me do his delivery called me after I'd just been up all night in another birth, so I was really tired. And the chief of OB came to that birth. He was just totally into the whole thing. In fact, he came to 2 or 3 more with me. And those days were wonderful because everybody sort of had such a nice outlook on things. I think that women were really compliant then. They were very interested in learning about birthing. They came to classes. They did everything we asked. They prepared their homes so beautifully. They had all the care providers and the food. In fact, I actually gained weight during those years because they always had wonderful birth food. But a couple of the obstetricians at Alta Bates Hospital actually had their babies at home with me also. And I know that there were probably feelings amongst the medical community about that. But we had lovely births. They were just wonderful. One of the births, we borrowed a baby to nurse the mother because the labor wasn't getting started and her water had broken. And that stimulated the birth. And so that was something new.
Let's talk about that. A lot of people don't know that oxytocin, or that the hormone that, say a little more about that.
When you breastfeed a baby, there's a hormone called oxytocin that's secreted, and the milk will let down with that. And also it will cause contractions of the uterus. Now, right after you have a baby, that's very handy because it makes your uterus go down faster. But when you're trying to start a labor, there are many different ways to start it, but one of them is to nurse another baby. And I've had to do that with several people. It's always hard to find a willing baby to nurse, but if there is one in the vicinity, they're very good at inducing labor because they make the oxytocin secrete in the mother.
Could you talk about why natural labor aids like that have no risk? They are effective, but they don't carry the risk of drugs?
I would say that the Pitocin that we use in the hospital, which is actually a synthetic form of oxytocin, works, but it has to be very carefully monitored and dripped very carefully because it could cause tetanic contractions. Now, breastfeeding someone else's baby or doing nipple stimulation can do the same thing, but you can regulate it by taking the baby off the breast or by stopping the nipple stimulation. I actually got my 7th baby going on the only weekend I could have had him because I had 3 babysitters lined up by doing nipple stimulation. Your husband is such a grand help in cases like that. At any rate, those...
You learned a lot about how to keep labor normal without using what's used in hospitals.
Right.
Can you talk about those years?
During the time that I was a home birth midwife as well as a lay midwife, I had to learn a lot of ways to get babies out because I don't use forceps. I still don't, even in the hospital. But I had doctors to back me up, but it meant transporting a woman, getting her health plan card out, getting her suitcase, driving to the hospital while she's in pain. It was just really difficult to do it. So we really tried lots of different ways, such as we tell people to make love before the time of birth, to put some of the prostaglandins into the vagina that would help the labor start. And now in the hospital we use prostaglandins to begin labors. I certainly used that because I needed to get my labor going, and it worked really well. In the old days when I was having babies, though, you were not supposed to have any kind of intercourse before about 6 weeks before your baby was born, and so I was always terrified they'd find out when I went in. At any rate, the other things we learned was positioning, putting women on their hands and knees, walking women so their pelvises would roll and kind of work the baby through. Something called lunging, where they lunge forward onto their feet this way to kind of help the baby come through the pelvis in the anterior way. My own daughter, most of my daughters and daughters-in-law have had me, actually all of them, at their births, and many of them I've delivered at home. When my daughter had her 2 babies at home, she always gets stuck at about 9 centimeters with a posterior baby.
What is a posterior baby?
A baby that's posterior, we jokingly call sunny side up, is a baby that is laying with its face toward the anterior of the mother and the back of its head in her posterior. So it's looking up at the sun. And the easiest way to get a baby through the pelvis is to have it looking down at her bottom end. So to turn those babies, we try positioning. Well, my daughter was getting really mad about 9 centimeters, especially with her second one, and she said, "This is ridiculous, Mother. I want to go to the hospital and get an epidural."
And let's talk about why it hurts so much, because back labor.
Right. She was surely in a lot of pain because when the baby's in a posterior position, it puts pressure on the back and gives you a lot of back pain. So she was quite right to be a little irritable about the whole thing.
Now, this is still a normal birth, so say that.
Yeah.
It just hurts more.
Her posterior baby was quite a normal presentation, and in fact, many of them come out that direction, just looking up at you. So it's a normal way to have a baby. It just takes a little longer, especially in the very last stages of labor. So it's harder to put up with. So she got out of bed, exclaiming to me that she was going to the hospital. That was all there was to it. And I said to her, okay, well, we have to get a bag for you and the baby, and we have to find your health plan, and we have to drive you to the hospital, and you'll go through the emergency room, and they will evaluate you. And she said, well, a few well-chosen swear words, "I'm just going to take care of this myself." And she just stomped into the living room as hard as she could go, lunging onto her feet, and threw herself into a white chair over a white rug and delivered her little boy, who was 8.5 pounds, immediately. And he was no longer sunny side up. He had turned with her stomping. So those are really, as I found out later, age-old remedies. The Chinese do something like that. They call it chunging for babies. And there's just many documentations in the past of women having to use that. And after all, they didn't have hospitals to go to then. So we've had a lot of fun at some of the births using weird positions. And in the hospital, when I began working there as a legal midwife, because I did finish midwifery school in '79, and it's been 18 years now that I've actually been working hospital and home, and doing prenatal care and taking care of women legally, and that's pretty nice to feel. In the hospitals, we've had to introduce those positions and those ideas of walking. Over the years, women were kept in bed. When I was having children, they said, "Oh, no, don't get out of bed," and they would catch me. They would start IVs. They wouldn't let them drink water. They wouldn't let them eat. At home births, we've had people eating for strength and whatever they feel like doing. If they throw it up, well, when you throw up, it pushes the baby down a little bit, so it's not such a bad thing. We put women in water. Water is just wonderful at births at home. We do have showers where I work, and I really, really hope that we could get tubs. They have said when they add on to the labor and delivery there, and they will have to make it bigger, they will add some tubs, and I'm really hoping that they will, because they work so well.
Tell us about tubs and water and
I'm a water person. I love water. I'm not fond of delivering babies underwater necessarily. I jokingly say I don't look so good in a bathing suit, but basically it's because it's very hard to see, and if you have a cord around the neck, it's hard to get in there and cut the cord. There's a lot of things that come out in the water that make it murky, and it's hard to see, but I do love to use it for labor. I know many people like to deliver underwater, but I love it when women labor in water, and I like to get in with them. It's wonderful. I think it relaxes the woman. It raises the abdominal wall.
what does that mean?
It just it relaxes the muscles here and lifts them off of the uterus, so there's not as much pain. Water in and of itself just is a painkiller. It's very relaxing. If you're doing breathing, you can make water sounds with your breathing. There's just so much with water that's wonderful. And we do use the showers that way, too. We put them in the hospital in the showers, and I've had women on their hands and knees in there for hours. We did have to tell the husbands to either bring a do not disturb sign or wear a bathing suit so the nurses didn't walk in on them. But it really is a nice way to help labor and to not use medications, to use water.
So home birth is all about what? talk about that. Home birth.
Well, home birth is about having choices, having some control over where you are. It's your home, it's your birth. You can do things the way you want to as long as things are medically progressing. And what I have found with the women that I've dealt with at home birth is that they're very willing to go along with what I'm telling them. And if they like something and it's not hurting as much but there's no progress, they're willing to get up and move into a spot, maybe where it isn't so comfortable. But to get things going, I really feel like that's important because they learn the trust with their midwife. They learn to know that she's going to tell them something that will help them to have their baby.
Let's talk a little bit about the fact that it's paradoxical that in a birth, what you really want is for things to be harder. You want it to feel worse in a sense, because that means you're closer to the birth.
That's true.
So when a woman says, "Oh, that felt better, that was easier," no, honey,
no,
that's the
it's
wrong
probably
direction.
wrong.
So let's talk about that. Normal birth, keeping birth normal. Go ahead.
Yeah, keeping a birth normal with positioning is sometimes pretty uncomfortable for the mother because she might really prefer to lie down and let the contractions back off a little bit. If they don't back off, fine, she can stay there. But if they do, we need to get her up and move. She's probably going to complain, but she'll usually do it. Now, I don't find that is always true of women that I'm attending in the hospital that haven't gotten a relationship with me, that haven't intended to have a midwife. They're just a little bit more apt to say, no, just take my pain away. And nowadays, in these 90s, I'm finding that women are having a harder time with preparing for their birth because they're working outside the home, they have to commute, they may have other children they have to pick up at a daycare center. By the time they get home, they hardly have time to go to a class, and perhaps they fall into bed and can't even find time to read about birth. So we're getting a different type of woman now at our births. Women that they do want to have a good birth, they want a healthy baby, but they're not too sure of all the things that go into that. And so they're asking for epidurals. Many of them still don't want epidurals. They want painkillers, or they want nothing, or they'll use the shower. But the larger majority are wanting us to take it away from them.
Can you talk a little bit about how you tell women the value of keeping on your feet, keeping labor going normal, rather than just using drugs to speed it up and drugs to take the pain away? What do you say to them? How do you talk
One
to
of the
them?
things that we talk about in the classes, okay, start again. One of the things that I talk to women about in classes that I teach where I work are what are the anatomical and physiological things that affect your birth, and how would it change it if you just lay down. It's better for you to walk, and I walk around the room and try to show them and to do a little belly dancing and to move yourself to help the baby come through. We use slides and show them the actual pictures of the pelvis and the baby, and we have a pelvis that we hold with a baby, trying to explain to them that they really have a lot that they can do to help themselves. In fact, even in prenatal care, we are teaching 2 classes of about 2.5 hours each, one at 8 to 10 weeks and one at 22 weeks, to explain the things that are changing with fetal development, why they may feel nauseous, why they're tired, what mood swings they might have, what hormones are affecting them, and also how their blood volume is going to change, how their pelvises are going to relax, their feet are going to get bigger, all the fun changes of pregnancy, but why they're done. Why does the body do it? Really important to know that.
So that crazy.
Yeah, the body's a very smart thing. It's pretty well made, with the exception of hemorrhoids. I would say that we've been made very well. So really, the women pick up on that, and then we start telling them, you can help yourself in pregnancy by eating good nutrition, and we go into quite a lot on nutrition. We also talk about how they can do kick counts to watch how their placenta is working, because if the baby slows down, the placenta may not be working well. So we talk to them about that. We talk a little bit about where the fundus is and how it grows up here and the normal growth of a pregnancy, and what they are being looked at for in their prenatal visits.
We talked to them about... Oh, okay. You have to explain the word fundus.